The National Health Insurance Bill has been approved by Parliament. That happened recently. It's designed to help all South Africans access quality health care. The Health Department believes that in order for the NHI to work, our health system needs to operate effectively. To explain this further, we're joined by the Department's Deputy Director General, Dr. Anban Pillay, who's with me here on eNCA Lunchtime. Doctor, very good afternoon to you. Thank you for coming in. So this bill, one step closer to becoming law, approved now by Cabinet. But as we sit, there is still no clear indication of just how much it's going to cost us.
Well, we have provided an indication in the white paper of 256 billion. That's what the Treasury had estimated at the time. The Treasury is going to be publishing, probably in the next 2 weeks, a revised costing on what the NHI will be costing us. So Treasury has been working on that, and they will publish those estimates.
The bill is not without critics. Just last week, in fact, we had on the Democratic Alliance on the program, and they were saying the bill in its current form is too expensive, it's not feasible. Is there any way of doing it for less, do you think?
Well, I think it's important to appreciate that in the costing of any health system, particularly into the future, we're talking about an NHI that's going to be implemented in probably the next 7 years or so. In doing so, one needs to recognize there are a number of uncertainties. And so you always err on the side of caution in terms of the costing. If I said to you tomorrow, what would it cost you for a basket of groceries in the supermarket? It will be very difficult for you to predict that in 7 years' time. And so in the same way, I think it's difficult for one to be accurate about what the costing will be. But the NHI will certainly be more efficient than what the current health system is in terms of its costs. Yeah.
We'll speak about efficiency in a moment, but in the debates about the NHI, a lot has been about efficiency, like you're saying, and the issues of costing. But I want us to take this opportunity to explain in real terms to the ordinary South African what an NHI South Africa would look like and what difference it would make in our daily lives.
So in an NHI South Africa, basically what would happen is that all South Africans would be registered with this NHI fund. And South Africans will then be able to have access to their general practitioner, their pharmacy, their dentist, their optometrist, etc., where they will access services. And the fund will pay those providers for those services. If they need to be referred up to hospital level, they'll be referred through to hospital or tertiary level care. So unlike what currently exists in the current system, where a public sector patient cannot access care from a general practitioner or go to pharmacy to get their medicines or their dentist, they'll now be able to do that. On the side of those that are on a medical scheme, they won't have co-payments. You currently have co-payments for your medical scheme. That won't exist. They will be paid on a capitation basis, and there won't be this limitation. Currently you have a limit of the number of consults you can do with the GP or what medicines you can access, etc. So the NHI will change the way those systems operate. So it's a benefit not only to those that are accessing care in the public sector, but also those that are accessing care in the private sector.
But there are people listening to us now, Dr. Pillay, having this conversation who say, well, government has made such a mess of running the public health care system, we cannot possibly rely on you to start the NHI process and run it successfully to a point where those with medical aid, for example, could easily say, in fact, I want to rely on this vehicle from government. Do you understand those fears? Do you have an appreciation for that?
No, I think we have a full appreciation of those fears. But I think the important thing for people to understand is that the NHI is a funding mechanism. In other words, it's a large fund. All we're doing is basically bringing all the various pots of money that are available for healthcare in the country into a single fund. The providers of healthcare remain the same. So if you went to a particular GP or a pharmacy in order to access your care, so you'll continue to do so. So on the supply side, we're not intervening in the way that would deny people access to the type of providers that they had before.
So it'll happen, you're hoping, over a 15-year period, broken into 3 phases, I think with 2 phases in now. Walk us through each.
So in this phase, which we call phase 2, we will be doing what we call health system strengthening, meaning to fix many of the problems in the public health system in laying the platform for the NHI. Secondly, we'll be moving through the legislation which goes through Parliament. That will happen during this phase. We'll then bring in a whole lot of alternative legislation that amends acts that currently exist. And then thirdly, we will start buying services, particularly for the vulnerable population, such as the elderly, maternal health, children, etc. And we'll be delivering those services for all South Africans. And in the final phase, we will then come up with an expansive plan which includes all South Africans. And as part of that process, people will then all be participating in the NHI, and the providers will all be contracted.
Mm-hmm. And part of this is this public consultation process that will begin in September. How is that going to work?
Well, that consultation is handled largely by Parliament. The National Council of Provinces will take the legislation to each of the provincial legislatures, and there will be public hearings across the country in each province, usually in a few districts in the province. There's town hall meetings where the public will be engaged on the bill, and they will share their views, and those views will then come back to the National Council of Provinces, and if there's a need for any amendments to the legislation, that will happen through that process.
Are you confident the bill in its current form will pass?
I think it will certainly pass. The principles will be there. There may be additions from the public, and we would welcome that, because the idea is to build a strengthened healthcare system that serves all South Africans.
Dr. Anban Pillay, thank you so much for your time.